And I'm here today in the office with him, excited for a little interview, a little Q&A session. How are you feeling today?
I am great. Right in between patients. We just did a whole bunch of operations today. Now heading into office hours to see consults and injections and all sorts of things.
And of course, he always has time for his patients and people out there on social media. You all are writing in all the time and we are listening, and he's here to answer some of your questions. First and foremost, let's start with this one. Can you get Botox after getting a facelift?
Absolutely. So Botox in combination with facelifts is super common. Now, let's just talk a little bit about facelifts because we get a lot of questions about this, and I do a lot of facelifts all day long. Every facelift is different. We individualize this process. Sometimes it's a full facelift. Sometimes it's just a little neck or a little jowl or what I call the mini or micro mini facelifts. Fitting the type of facelifts to the person is so important. Now, Botox. Botox gets rid of the wrinkles, forehead, glabellar, crow's feet, and a couple of other areas. So yes to Botox plus facelift is great. And there are other things that I also do with facelifts. I often will laser somebody to get rid of fine lines and wrinkles. I often put a little fat transfer in. So it's really about making each and every person look great, but individualizing it.
Individualize and customize right here at your service. He is. All right. We have plenty more questions. And this one says, do you place the implants over or under the muscle?
Okay, so breast implants, like faces, individualize this process, figure out what the patient's anatomy is. We do a lot of computer analysis and things like that. Typically, my implants go underneath the muscle. I typically like to use the silicone gummy bear implants because they're softer, they're more natural. They really do well long-term as well. So under the muscle. And a breast implant only takes about 20 or 30 minutes. That's it.
Wow, that quick? All right, I've had both. I've had them over the muscle originally when I was younger, and then you put them under the muscle, which I prefer to say I like for my body. So thank you for that. Okay, what's the difference between a lip lift and lip filler?
All right, so there is something called a lip lift surgically where we make an incision underneath the nose and pull the lip up. There is also lip filler where we just make the lip a little bit more plump. I often get a little bit of a lip lift with Botox as well. So it depends on the person's anatomy. A surgical lip lift is done in somebody who has a really long distance between their nose and their lip, and their lip is kind of inturned. But if we want to turn it out a bit, we can use filler or we can do a lip lift.
Do people do like lip implants like the old Lisa Rinna look anymore?
Not really. Instead of doing the lip implants that we used to do 20 or plus years ago, we typically are using lip filler for that.
All right. Thanks so much. Now, let me ask you about how much fat can you take out with liposuction?
So liposuction, Jill, is one of the most common cosmetic surgery procedures in the United States. Breast implants and liposuction, two most common procedures. We can take out up to 5 liters of fat. Now, think about it. That's a lot of fat. Yeah, and each one of those big Coke bottles is 2 liters. So this is 2.5 of those. 5 liters of pure fat is what we can take out. Often patients don't need that much. We do little areas, and we don't have to take out that much fat.
All right. Well, how do fat bags under the eyes form, and how can we get rid of them?
Very common. Fat bags under your eyes excuse me, are common and get worse as we get older. And it's the fat that was always there, but now tends to protrude as the kind of the wall that kept in the fat loosens. And now you have that little fat pocket. What I do is I go from the inside, I turn down the lid, I pluck out the fat, and it's smooth forever.
And you just did our friend here, Jocelyn, at the office, which, by the way, she's looking and feeling great already.
Yeah, not bad after she's just like 4 or 5 days. All that fat is gone. When you do the upper eyelids, I make an incision in the crease and remove the extra skin. But for the lowers, it's done without incisions, and you're flat there forever.
All right. Also, some people want to know after they have liposuction, a lot of people say, hey, I also want a fat transfer. Where on the body can you transfer fat to?
Most common places to transfer fat, number one, the butt, which is called the Brazilian butt lift. So we take the fat out, abdomen, love handles, legs, wherever it comes from, we put it in the butt, or that hip dip that sometimes people have. And then other places like the fat into the face works well. fat into the breast if you just want a little bit of a increase in volume, but not too much. So those are the areas for fat. There is a new fat made in the laboratory now as well called alliclay. Now, alliclay,
Never heard of this.
it's actually purified cadaver fat, which we can use for the face, we can use for the butt, we can use in different areas. And that works well, and we're doing a bunch of alliclay now to the butt and to the breasts and to the hip dips.
Oh my goodness. All right, so my son is 8, and he loves doing this to mom. Ready? Jiggle, 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 jiggle. And I don't have that much, but a lot of us do have arm fat. And a lot of people are really concerned with that. So my question is, how would you address that for someone who comes in with a really fatty arm?
So arm fat's interesting because sometimes it's skin and sometimes it's fat. So we have to make a determination. If you have a ton of extra skin, like patients who lose a lot of weight, the only way to do it is an arm lift. So what we do is we make an incision, we borrow your arm this way. For an arm lift, we would make an incision here and remove that extra skin and fat. You don't have a lot. And that's for somebody with a ton of extra skin there. Okay. If you just have extra fat, we can do liposuction. Okay. So we liposuction the fat out. It works very nicely to help bring that up. And there's also a laser that we use called the J-plasma Renuvion laser.
Everyone's calling about this. Tell us about it.
So it's a laser that goes under the skin and helps retract the skin, and it decreases the amount of skin. Not great for someone who has a ton of skin, but good for somebody who has a little extra skin. We use the Renuvion laser in the abdomen, the chin, the whole body basically, and the arms.
Wow, impressive. Obviously, you'll have a scar, but there's also great news with scarring here because you treat scars too.
Yeah, we do. For Renuvion, for lipo, there's not much of you don't really see a scar. For the arm lift called brachioplasty, if that scar is there, we typically can treat it. Everybody heals differently.
Yeah, I talk to so many of your patients now that I'm working here, and a lot of them say, I'm so frustrated with this extra excess skin. I don't care. I will exchange it for a scar in a heartbeat, and they're so happy, including my aunt who had work done by you as well. So thank you for that. All right, how many cup sizes can we go down on our breasts after a breast reduction?
Breast reduction, super common procedure, and I know you guys out there are suffering with the bigger breasts and neck pain and back pain and shoulder grooving and rashes and all those sort of things. So we can do breast reductions, and we can go down pretty substantially depending upon the patient, depending upon how big they are. But typically, I can get you down a lot to decrease the symptoms. That's a 2-hour procedure, ambulatory. You go home right away after. And sometimes now even we can get insurance to cover breast reductions depending upon the policy that the person has.
Love that. All right. Also, a lot of the patients I see coming in the next day after you're with them in the OR, and they're feeling great, they're looking great. So I'm like, wait, is this the Greenberg Rapid Recovery Program? What's happening, and what is that all about?
Yeah, so listen, we've been doing this a long time, over 30 years, and we perfected different ways to do rapid recovery systems. Patients get back to normal activities, and you're right, they come in the next day feeling really pretty good. So in those patients, we do different things to decrease the amount of recovery, decrease the amount of pain. Patients are always shocked that it's really not that painful and the recovery is not as bad as a lot of people think.
Also, got to ask about a tummy tuck. A lot of moms out there, right? And needing that type of service in a sense, like our friends here. By the way, a tummy tuck, what is the recovery process like? And really, how long will it take to get back on your feet to go to work?
So recovery for tummy tuck, and what I say is usually about a week off from work, but it's 4 weeks before you can go back to the gym and heavy lifting and things like that. You're up and around that day after a tummy tuck, just nothing too strenuous for about a week.
All right. Someone else asking, how do you know when to exchange your breast implants? Good question.
Yeah, great question. The older breast implants, I usually say 10 years. The newer ones we can keep in unless there's an issue with them, but we follow you along every few years with MRIs to make sure that you are actually looking good and that the implant is okay.
All right, a term I just brought up before in regards to tummy tucks, but the mommy makeover. Can you explain what that is? Because a lot of people do call saying, what procedures are all involved with the mommy makeover specifically?
The mommy makeover usually combines different procedures such as the breasts, either a breast lift, reduction, lift, something like that, a tummy tuck, and usually some liposuction of the legs or some cellulite treatment or Renuvion, skin tightening, things like that. It's a combination of multiple procedures to get the body back to where it was before pregnancy. The modern mommy makeover that we started to do many years ago includes vaginal rejuvenation, maybe labiaplasty, those sort of things. So we have the whole body covered, and we can get you back to your pre-baby body.
And you have a whole team here for that as well.
Yeah. So we have a full skin spa here, and we can help with the face and the skin tightening and the body tightening and stuff like that. So we combine everything here at Greenberg Cosmetics.
All right. One of the biggest issues I'm starting to notice the jowls and all these lines, and a lot of people come in with the same problem. So what is your take on that as far as how can we start treating the jowls? That seems very difficult.
Listen, the gels, which is the fat that was once up higher in the face, we can do some skin tightening techniques. We can do a bunch of different injections to help camouflage. If the gels are bad, if the neck is bad, we do have to do a little mini lift on you, and that will take care of them for a while. But there's all sorts of combination therapies that we can do to get your face back to the way you want. It's all about looking natural, though.
That's true. We don't want to look a little too Catwoman.
Yeah, I hate fake looking things. So you're never going to come from any of the surgeons here at Greenberg Cosmetic Surgery with that crazy look. It's all about looking natural and looking your best.
Perfect. All right. Another question. Where is the incision actually placed when you're doing your eyes for the upper and the lower eyelid?
For the upper eyelid, I make the incision in the crease, so you can't really see it up there. And the lower's from the inside, so there's no scars, and you're flat forever. I often, by the way, when I do my lower lids, will do a light laser peel at the same time.
And what about the darkening under the eyes? What would help with that?
Yeah, so that's hard to get rid of. When you take out the fat pocket there, it makes that dark circle look much better, and sometimes it's creams and stuff that we can do at the same time.
All right, hold on. We got a whole bunch of questions here. We have a whole bunch going on, but let's do this. The last question for the day is, Dr. Greenberg, what do you love most about being here in practice for so many years? And I mean, I know you love your patients, but really, what is that keeps you coming to work every day?
Yeah, I love what I do. I love making patients look better. I love making patients feel better about themselves. I strive for the best possible results in each and every patient. We have a great crew here. We have great aftercare. It's so important. Our nurses, our team, you guys, you just do a phenomenal job day in and day out. But getting those great results is something that we all here strive for every day.
Well, I love getting to wake up to see you on social media. I see you talking and, of course, commenting on Kylie Jenner and everything that's going on. So I love your social media posts. So Cahoots, over to our social media team. If you could turn the camera around, say hi. But they're too shy. But really, thank you so much. A pleasure having you here. And I'm so sorry because he's got to get back to work. But I appreciate you taking the time out and, of course, answering our questions. Feel free to keep writing in. And, of course, our social media team, the shy team behind the camera, will get back to you. Looking forward to speaking with you all again, okay? Enjoy your day. Let's get ready for summer. Let's look good. Come see Dr. Greenberg. Come on in.